This podcast is for informational and educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Patients in need of medical advice should consult their personal health care provider. From UPMC Children's Hospital of Pittsburgh, welcome to That's Pediatric. I'm Steph Dewar, one of your co-hosts. I'm the Program Director of the Pediatric Residency Training Program, a member of the Division of Pediatric Hospital Medicine, and Vice Chair of Clinical Affairs.
And I'm John Williams, Division Chief of Pediatric Infectious Diseases, Director of the Institute for Infection, Immunity, and Inflammation in Children, and a Professor of Pediatrics. And I am delighted to welcome our guest today, Dr. Serena Chan, MD. Dr. Chan is an Assistant Professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences, with secondary appointments in the Departments of Surgery and Pediatrics. And here at UPMC Children's, she's in the Division of Pediatric and Adolescent Gynecology. Dr. Chan, welcome.
Hello, thank you for having me.
Well, we're so excited to meet you today and learn a little bit about the type of clinical work that you're doing here at Children's.
Sure. So I am a pediatric adolescent gynecologist, as you alluded to, and so I see girls essentially from birth through their mid-20s. And I see a whole range of issues, from medical reproductive endocrine issues such as PCOS or ovarian insufficiency to surgical issues such as ovarian cysts or congenital anomalies of the reproductive tract. So I definitely see a wide variety of issues.
That's so interesting because, you're sort of, I guess we'd say adult obstetrics and gynecology colleagues would really only be seeing that older half. They wouldn't be seeing any of these early childhood things, correct?
That's correct. So after finishing my residency in obstetrics and gynecology, I went on and did a clinical fellowship in pediatric and adolescent gynecology. It's a 2-year fellowship. And so after completing that fellowship, that's when I came here to Children's in Pittsburgh.
So I'm just curious, how is it that you found us here in Pittsburgh? And what was it that drew you to that specialization in OB-GYN?
Sure. So regarding pediatric and adolescent gynecology as a subspecialty, some of the things that really drew me to the subspecialty during residency was that I was interested in a lot of the congenital anomalies that we would see in girls. And traditionally, that falls under the purview of reproductive endocrinology and infertility. And I was also interested in a lot of the reproductive endocrine issues that we see in girls and women. However, the in vitro fertilization and all of that did not quite interest me as much. And in medical school, I was fortunate enough to be at a place where they actually did have someone who was practicing pediatric and adolescent gynecology. And then here, I actually did my residency at McGee. And so I had some additional exposure, and that's how I found out more about the specialty. And I went away for a fellowship, and when it came time to look for a job, it just so happened that Liz Miller in adolescent medicine and Dr. Sanfilippo over at McGee, they had spoken with Dr. DeSimo at that time, and they basically decided, you know what, it's time to start a division here. And so I was actively recruited to come back.
Well, I'm glad that you mentioned adolescent medicine group, because I was just curious how your work overlaps with their work, what you do for them, what they do for you, and what types of referrals you have.
Sure. I definitely have a fantastic working relationship with adolescent medicine, and their fellows sometimes do work with me to train a little bit more in gynecology. Essentially, you can think of the gynecologic issues that adolescent medicine would cover would include things like contraception, menstrual suppression. They're very comfortable managing some of the medical aspects of gynecology, addressing STDs, that sort of thing. If there's anything that may require possible surgery, that's typically when they would refer to me, or if a patient has dysmenorrhea that is not controlled with our standard hormonal medications, where they may refer to me for additional evaluation for possible endometriosis. And so there's some overlap in what we do. With being a division of one, I have a limited number of appointment slots, and so they definitely help take care of the general gynecologic issues that they are able to handle, and that way patients who need to see me are able to get appointments.
So Dr. Chan, what are some of the new or current recommendations in your field, and are they changing?
That's a great question. So obviously, if a girl has any sort of reproductive health or gynecologic issue, we will see them at any time. But in general, the recommendation per ACOG at this time is that between the ages of 13 to 15, that's when a girl should be introduced to the gynecologist. And it's important to note that this first visit may not involve any sort of pelvic exam. It's really an opportunity to discuss reproductive health, menstruation, contraception, and also introduce that confidential interview where girls can feel comfortable discussing issues in a confidential manner.
So that's a very different recommendation than I was first aware of. I've been doing this medicine thing for several decades now. And at that age, I would only refer a patient that was having some sort of problem, not for routine introduction to gynecology.
Yes. So ACOG a few years ago came out with these explicit recommendations, I think because, obviously young adolescents are very impressionable. And I think to instill some anticipatory guidance, although pediatricians, I think, do a fantastic job of that. Obviously, they have very limited time in a 15-minute appointment to cover everything. And so it can be nice to have a separate visit with a gynecologist just to review reproductive health in more detail.
And following along with those ACOG recommendations, is there recommended age for initiation of regular pelvic exam, PAPs and pelvics, etc.?
Yes, that's another great question because definitely PAP screening guidelines have changed over the years. Basically, in terms of pelvic exams in adolescents, it's mainly done for symptoms. So for someone who's, let's say, is starting hormonal medication for control of menstrual symptoms at 13, they don't necessarily need an internal pelvic exam at that time. Certainly, if someone has symptoms such as unusual vaginal discharge, pelvic pain, and they're sexually active, a pelvic exam may be indicated in that situation. In terms of initiation of PAP tests or cervical cancer screening, the recommendation right now is starting at 21 years old, regardless of whether or not a girl has received the HPV vaccine series. There are some special circumstances for girls who may be significantly immunocompromised. For example, girls with HIV infection or who have had solid organ transplantation and are on immunosuppression. But otherwise, 21 is the age we would start doing PAP tests.
So I'm glad you mentioned the HPV vaccine because that's an intervention that you've seen in your career. And I'm curious what your knowledge is of the evidence of decrease in infection transmission rates.
Sure. And I don't have all the data at my fingertips, but I do know that in countries where there is universal HPV vaccination, such as Australia, actually, quite a few years ago, we already had data showing that the rate of genital warts was significantly decreased. And I think we now have some data that the rate of cervical cancer has also decreased in those settings.
And in Australia, about which I know nothing about their immunization recommendations for HPV, do they universally recommend for all kids, both males and females?
I believe so.
Okay. So I know that when we initiated that here in this country, it was just for female patients, but I'm under the impression now that we're universally recommending it for all kids.
That's correct.
Yeah, no, that's a question I had too, Dr. Sham, because I actually, when I was in college, I got a work-study job in a lab of a physician that studied HPV. He was actually the person that inspired me to go to medical school. That was like you, Steph. That was a few decades ago, we'll just say. And in med school, I saw lots of, unfortunately, of women suffering and even dying from cervical cancer. And then this vaccine, comes along that's really life-saving. How are we doing at getting it to our adolescents here in Pittsburgh or nationally? Are we doing a good job?
I think, at least from the patients that I've seen, I think our pediatricians, say at CCP and some other practices, are doing a really good job of making the HPV vaccine, counseling patients that it's a routine childhood adolescent vaccine. And so in the past where it was more offered as an option, I think that's where we had less uptake. And I definitely feel like offering it as a routine recommended childhood vaccination has helped. We definitely still have some patients or families who are quite anti-vaccine in general, and I do think that's kind of a different situation. But I do find appropriate education is important. For example, just today, actually, I had a patient whose mom asked, who basically said that they had a family history of cervical cancer and they wanted to know what they could do to minimize her risks. And that was an opportunity to explain that HPV is the cause of cervical cancer in the vast majority of cases, and we have this fantastic vaccine.
Yeah, I mean, I think it's a remarkable thing. When somebody's had that experience, having seen all the patients I saw, we made sure all of our kids got the vaccine. I don't think it's optional to prevent cancer if you can. Or it shouldn't be.
Actually, when I was a fourth-year medical student, I worked with a pediatrician in the community who had a great way of approaching the vaccine with his patients. He basically said, even if your daughter or son chooses to remain abstinent until marriage, perhaps they can't help with who they fall in love with, and they don't know whether or not their partner will carry the HPV virus. And I think that's perhaps a little bit more acceptable to some parents.
Exactly. I think that's an excellent segue into, so what was it that got you into medicine, or how did you move along this path to where you are now?
I think we can hold off on going all the way back to grade school. But I think in college, I definitely knew I had an interest in women's health. And actually, my research in undergrad was in ovarian cancer. But that got me into got me interested in medicine and ultimately OBGYN. Basically, what I loved about OBGYN was the intersection of women's health along with surgery. And specifically when it comes to the surgeries that we do for pediatric and adolescent gynecology, there are some surgeries that are very dictated by protocol, but sometimes you need to think a little bit outside the box for some of these congenital anomalies. And that's definitely something that stimulated my interest.
And so those surgeries, are those done here at Children's?
Yes, they are. So it may be anything as simple as a hymenectomy for a septate hymen, all the way to creation of a neovagina for a girl with MRKH, or congenital absence of uterus and vagina, or various forms of vaginal septums, obstructing or non-obstructing.
So, Dr. Chan, you mentioned that you worked in the area to some extent of fertility. What kind of things are you doing with our younger patients in the area of fertility medicine?
Sure. So that falls into a couple of categories. We do have some patients who may develop ovarian insufficiency just because of their specific medical condition or for idiopathic reasons. And in that situation, I, along with pediatric endocrinology, oftentimes will help with hormone replacement therapy to help patients complete pubertal progression and then keep them on maintenance hormone replacement for physiologic levels of estrogen that their ovaries should be making. In terms of fertility preservation, when it comes to treatments that we know can impact fertility, that is actually something that's very up and coming. And here at Children's, we've really been building our fertility preservation program. So basically, when it comes to girls who are undergoing some sort of therapy that may put them at high risk for infertility, we do have two options that are now actually considered standard of care. Actually, hot off the press, just recently, ovarian tissue cryopreservation is now considered standard of care per the American Society of Reproductive Medicine. But really, any girl who may be at risk for infertility because of treatment that they're undergoing can undergo egg freezing or oocyte cryopreservation, and that's been considered standard of care for quite a while now. However, that does take time. It can take 2 weeks or longer in order to do an expedited cycle for egg freezing. And in some cases, let's say a girl who has Hodgkin's lymphoma of the chest and they need to start chemotherapy in an urgent fashion, and someone who is at high risk for infertility, we do offer ovarian tissue cryopreservation. It's still under an IRB protocol here, and until recently was considered an experimental procedure, but it is something that we offer for both pubertal and prepubertal girls. And actually, UPMC right now, we've just recently opened our Center for Reproductive Transplantation as well. We're not talking about uterine transplantation, but it's for transplantation of ovarian tissue back in women who have had ovarian tissue frozen for fertility preservation. And I work very closely with our hem-onc colleagues in this area. And really, I think in the past 3 years here at Children's, we've really, I think, done a better job of making sure that patients and families know what their fertility preservation options are. Of course, we still focus on the most urgent treatment at hand, but we make sure that families are aware that we are thinking about their child's future.
Wow, that's just amazing. And I think since so many children, unlike adults with cancer, many children do extremely well and are cured. It's really nice that people like you are thinking about their future down the road beyond the immediate treatment. So can I ask, what's your favorite thing about your job?
There are many things that I like about my job. Certainly sometimes, for example, for girls with chronic pelvic pain who turn out to have endometriosis, while we start out with medical treatment, ultimately surgery may be indicated. And in some instances, the significant pain relief these girls have, and even just saying, you know what, thank you for believing me when I said I had pain, that can definitely be very gratifying to make a difference in that way. But sometimes it's as simple as, let's say, explaining something as simple as the menstrual cycle to a girl and having her get it. Simple things like that where you can feel like you're really educating your patients in important ways.
So, Serena, you've mentioned several subspecialty groups that refer to you. Where is it that most of your patients come from?
I actually have a huge referral population just from our pediatricians here in the community. So that's a lot of my patients come from them. Sometimes I also get referrals from adolescent medicine, for example, patients who may need surgical intervention or their issues are refractory to medical management. And then I've also built a relationship with some of the adult OB/GYN providers, some through my time as a resident here. And so I definitely get some referrals through them as well. But I would say that the vast majority of my referrals come through the pediatricians. The subspecialists here at Children's also refer quite a few patients to me, but I would say pediatricians are probably the largest population, or PCPs in general.
Well, Dr. Chan, it's really been fascinating learning about what you do on the border of, surgery and medicine and from infancy to adulthood. So I'm just delighted that you were able to join us today.
Yes, thanks for coming and telling us about what you have available here for our patients.
Thank you very much.
You can find other episodes of That's Pediatrics on iTunes, Google Play Music, and YouTube. Be sure to subscribe to keep up with new content. Leave a review and tell us what other topics you'd like our experts to cover. Thanks for listening.